Why proper eye drop technique matters. When treating eye conditions, like glaucoma, eye drops deliver medication directly to the eye. However, much of a drop can wash away through the tear ducts into the body, lowering the drug's effect on the eye and raising the risk of side effects. For example, studies estimate that up to 80% of a topical eye drop drains through the nasolacrimal tear duct. In the case of beta blocker drops, such as timolol for glaucoma, significant systemic absorption can occur, enough to slow the heart rate or trigger asthma symptoms in susceptible patients. Simple steps like gently closing the eyes and pressing on the tear duct, the nasolacrimal occlusion technique, dramatically boost the amount of drug remaining in the eye and cut the spillover into the body. In fact, classic studies found that occlusion and eyelid closure together reduced systemic timolol levels by over 60%, while increasing its concentration in the eye. In practice, this can translate to better control of eye pressure and far fewer side effects. For example, one glaucoma specialist reported that adding occlusion to routine drops gave patients 30 to 40% more intraocular pressure reduction than drops alone. How occlusion and eyelid closure help. The drug in an eye drop must first soak into the surface of the eye to work. When you press the drop onto the eye, part of it is absorbed by the cornea and anterior tissues, but a large portion can run off into the nose through the tear duct. By pressing gently on the inner corner of the eye, over the punctum, for a minute or two, you block that drainage path. This tricks the eye into holding on to more of the medication, effectively raising the ocular bioavailability. In lay terms, more of each drop stays where it belongs, on the eye, instead of entering the bloodstream. Closing your eyes for 2 to 3 minutes after instilling the drop has a similar benefit. It stops blinking and spreads the drop evenly, further keeping it on the eye. Medical reviews note that these simple measures improve the therapeutic index of glaucoma drops, meaning they make the treatment more effective and safer. In practical terms, combining occlusion and eyelid closure can prolong the drug's action in the eye and sharply cut its absorption into the body, with studies showing greatly reduced blood levels of the drug while the eye still gets a full dose. Step-by-step eye drop technique. Before you begin, wash your hands thoroughly with soap and dry them. Gather the dropper bottle. Ensure it's at room temperature and well mixed if needed, and a clean tissue or cloth. Check that the bottle tip is clean and that you're using the correct medication. Be careful not to touch the bottle tip with any surface, including your hands or eye, to avoid contamination. If the tip accidentally touches eyelashes or skin, wipe it with a clean tissue or use a new bottle. Figure: handle the eye drop bottle carefully. Do not let the tip touch your eye or eyelid. This keeps the bottle sterile and prevents infection. Position yourself. Tilt your head back slightly or lie down. Pull the lower eyelid down gently with your non-dominant hand to make a small pocket between the eyelid and the eye. Try not to press on the eyeball itself. Look up toward the ceiling. Instill a drop. Hold the dropper in your other hand as close to the eye as comfortable, 1 to 2 centimeters, without touching the eye. Squeeze the bottle gently to release 1 drop into the pocket of the lower eyelid. 1 properly placed drop is enough. Excess will overflow and not add benefit. If you accidentally blink or the drop misses, you may blink a few times or try a second drop, but avoid multiple drops at once. More than 1 drop per dose offers no extra effect. Figure: aim 1 drop into the lower eyelid pocket. Avoid touching the eye with the dropper tip. Apply punctal occlusion. Immediately after the drop goes in, close your eye gently, don't squeeze tightly, and place your index finger on the tear duct area, the inner corner of the eye by the nose. Press lightly for about 1 to 3 minutes. This pressure, occlusion, prevents the medicine from draining into the nose. You should feel slight pressure, but it shouldn't hurt. Another approach is simply keeping both eyes closed, but direct punctal occlusion with a finger tends to be more effective in blocking drainage. Maintain eyelid closure. Even after occluding, it's helpful to keep your eyelids closed and relax for another 1 to 2 minutes in total, up to 5 minutes if you can. Avoid blinking and let the drop absorb. This maximizes contact time on the eye surface. Breathe through your mouth to avoid irritation and use this time to apply the same pressure if possible. Afterward, if you see any excess liquid around your eye, blot gently with the clean tissue. Do not rub. Figure. After instilling the drop, close the eyes and gently press on the inner corner to hold the medication on the eye. Repeat if needed. If you must use another type of eye drop, for example, a second glaucoma medication, wait 5 to 10 minutes before putting in the next one. This gap allows the first drop to settle and prevents the second drop from washing it away. A common rule is at least 5 minutes. Busy doctors often say it's like putting 2 people in a nearly full bathtub. The water or medication will overflow if done too quickly. If you will apply eye ointment, do it last after the drops and wait at least 10 minutes. Ointments blur vision, so they go on at night or after drops. Number of drops. Generally, 1 drop per eye per dose is sufficient. Using more than 1 drop at the same time in one eye is wasteful. The eye can only hold about 1 drop's worth in its cul-de-sac. Excess immediately spills into the tear duct. If you feel the need for more, for example, if the drop quickly leaked out, it's better to reapply a single drop after a short blink or two, rather than squeezing multiple drops in quick succession. Always follow your doctor's instructions on how many drops. Most regimen calls for just 1. Prevent bottle tip contamination. After administering the drop, recap the bottle promptly. Never touch the tip to any surface. If you accidentally touch it, or if the tip looks dirty, clean it with a sterile tissue. Store the bottle in a clean, cool place as directed. Some eye drops need refrigeration after opening. Check the label. Never share eye drop bottles with others. Used bottles, especially those without preservatives, can harbor bacteria. Studies show contamination of opened eye drop bottles can range from a few percent up to nearly 100% in some cases. By avoiding contact with the tip and capping immediately, you greatly reduce the risk of eye infections. Tips for caregivers. If you're helping a child or someone with mobility issues, have them lie down on their back. Stand or sit beside them. You can stabilize their head and eyelid with one hand while instilling the drop with the other. Speak calmly to reassure them. For young children, applying a little numbing drop first, if prescribed, can help. Always supervise until the patient is comfortable doing it themselves. Benefits: better IOP control, fewer side effects. By improving how much medication stays on the eye, these techniques can significantly enhance glaucoma treatment. Remember, IOP stands for intraocular pressure. One practical study found that teaching patients punctal occlusion and eyelid closure as standard practice produced more reliable pressure-lowering results without increasing medication dose. In fact, many clinicians report that adding occlusion to their patients' routine had effects comparable to adding another medication. Untreated, the same patients regained a third or more of their original eye pressure reduction. At the same time, systemic side effects drop. For beta-blocker eye drops like timolol, fewer pills get absorbed into the body, so you're less likely to feel heart or breathing effects. Overall, proper punctal occlusion and eye closure could minimize dosage requirements, as well as side effects, according to researchers. In other words, patients often end up using lower effective doses of the eye drop when these simple techniques are used. Conclusion: mastering eye drop technique, especially nasolacrimal occlusion and gentle eyelid closure, is a powerful yet easy way to make your medications work better and safer. It only takes a few extra minutes after each dose, but the payoff can be dramatic. Better control of eye pressure and fewer systemic symptoms. Patients should be encouraged to use only 1 drop per dose. Wait about 5 minutes between different drops, and never let the bottle tip touch the eye to avoid contamination. Over time, these habits can improve treatment success and comfort. Always follow your eye doctor's instructions, and don't hesitate to ask for a demonstration if you're unsure. Proper technique is part of good eye care. It helps each drop do its full job, keeping your vision protected with minimal risk. All links to sources are available in the text version of this article. You can find the full article at visualfieldtest.com. Thanks for listening. To check your visual field, click the link at the bottom of this article or visit visualfieldtest.com.